Not easy for sure, Mr. Glassman.
I'm glad.
Thank you.
No. And I'm glad you said Harford County, that you come up and meet in Harford County.
Absolutely. It is so lovely up there. Well, former federal prosecutor and former mayoral candidate THEODORE Vignarajah joins us now as well. He has been working to support restaurants in the city. Let's listen to another statement from Mayor Scott on his reasoning for the ban on in-person dining in the city. And we should mention that Mayor Scott was invited to take part in our town hall tonight, but was unable to attend. Let's listen to what he had to say.
Here in Baltimore City, we have 11 hospitals. So when people get sick, as they did throughout COVID, if they get sick in Howard County and Baltimore County or wherever, you know where they end up? They end up here. So we have a higher level of responsibility.
What is your response to the mayor's defense of indoor dining ban in the city, Mr. Vignarajah?
Yeah, Mary, thanks so much for helping convene this conversation. You know, this is such a sober, informed, reasonable conversation about this subject, and I wish that Baltimore City had taken that approach. I think a lot of folks are frustrated that on the one hand, we kept casinos and gyms open, but closed outdoor dining. I think people are frustrated that outside of the state of California, Baltimore City is the only jurisdiction in the country that we found that has banned outdoor dining. And the notion that that is justified because we have more hospitals than other places, I don't know that it makes much sense. I think, you know, the focus on science and data is exactly the right place to start. And if you look at the science and data, two things are very clear. It's exactly right. We didn't know very much when we started this. I think County Executive Glassman and others had some very, very difficult decisions to make. But 9 months into the pandemic, we had some sense of what was driving the virus spread and what wasn't. And restaurants were just not the cause.
Let me say this real quickly. Fox 45 did some research on the cases in the city, and we're going to show a map, and it shows that only one zip code in the city was above the national average in cases per 1,000 residents, and more than 24 zip codes are significantly below the national average. So this is playing into what you are saying, Mr. Vignarajah.
I think that's exactly right. I mean, if you look at the positivity rate, if you expected the ban to have an impact, then you would expect the positivity rate to head down. It just hasn't. We've got this live experiment happening in Maryland. Baltimore City and Baltimore County have taken very different approaches. If you go and look at early December, the positivity rate and the daily cases in each of those jurisdictions, they've essentially stayed the same a month later, which means the ban in Baltimore City didn't help. And in fact, Baltimore County, which doesn't have a ban, seems to be doing a little bit better. Those are the kinds of things that need to guide policy decisions. These are hard decisions. Nobody is doubting that this is a tragedy of epic proportions. 300,000 people dead, millions more hospitalized, Black and brown communities at greatest risk, along with the elderly and immunocompromised. Everybody knows we have to take it seriously, but taking it seriously doesn't mean thumping your chest and making a decision. It means looking at the data and being guided by the science.
Do you think state and federal governments have done enough to compensate restaurants and businesses that have been forced to close due to the restrictions?
I mean, the short answer is no. I mean, we need a lot more than a life jacket. We need a lifeboat. We need some real assistance, particularly here in Baltimore City. You've got over 1,200 restaurants in the city, 20,000 employees that essentially were told to shutter their doors 2 weeks before Christmas. 9 months ago, we had payroll protection, we had unemployment insurance, we had some safety nets. But now in December and January, when none of that is here, to pull out the rug in this moment of real struggle, I think was done a little irresponsibly when you had no protection and no support for these businesses.
All right, Mr. Vignarajah, thank you. We're going to bring in economist Dr. Irani of Towson University. Dr. Irani, the National Restaurant Association says 1 in 6 restaurants, more than 100,000 nationwide, have closed permanently. And nearly 3 million restaurant employees are out of work. What is the lasting impact on the restaurant industry?
So, well, thank you, Mary, for convening this. So this is a major impact of the restaurant industry. Not only, with the shutdowns and the reduced capacity for many restaurants, but also, many places in Baltimore City are missing the business lunch crowd. So we're not seeing individuals, who are now working from home are not, patronizing many restaurants in the downtown business district. So that's impacted. Takeout can only go so far, so it's that challenge. And so, as the colleagues have said on the call here, the positivity rates aren't moving upward because of restaurants being open or 50% capacity. This is, something to consider because, restaurants, are oftentimes a great job opportunity for many individuals in our communities. And I will say, unfortunately, this pandemic has really impacted lower wage individuals more so than upper middle class households across this state, across this nation. And these are the individuals, need the most help. And so I would argue that, clearly more help is needed to support the restaurant industries going forward until basically we can bridge between now and recovery.
And what about damage to other businesses in Baltimore and the impact really on the entire city's economy?
Oh, it's tremendous. So, you think about a restaurant. Well, you've got your linens, you've got you're ordering new glasses, you've got, all the carpet cleaning, all the services, you've got Cisco delivering food. All those get impacted, and all those support businesses that provide, the supply chain to restaurants are all adversely impacted by them shutting down. So it could have lasting impacts. Everything from the small farm to table operation will be adversely impacted to the startup company that provides janitorial services to many of the restaurants, hotels. All those things have been adversely impacted and could have lasting impacts.
I want to pivot back to Mr. King and ask you, can restaurants really survive at 25% capacity? Can they make money? Can they exist that way?
No. Quite frankly, and we've now probably created 25 different business models over the last 10 months. We've been at 25%, 50% completely closed, carry out only. We've had to be magicians and try to figure this out every 3 weeks. We feel like we're creating a new business model. The reality of the situation is, while, we were successful in Anne Arundel County, it was very bittersweet because I felt like I won a battle, but I won a battle to go back, work 18-hour days and lose more money. What we're seeing now across our industry is proprietors making a decision. They've accumulated debt for 10 months, and they've got to make a decision. Do they continue to cash in their kids' college funds, take home equity line of credits out, charge high-interest credit cards, take high-interest loans from banks, or throw the towel in? And what we're seeing is, with each week that goes by, more and more restaurant owners are throwing the towel in and making the decision, I just can't lose my home over this, or I just can't lose my life savings over this. And many of them have already burnt through that, and there's nowhere else for them to go, and they're at the end of the rope, so they don't have a choice. At 25%, the majority of restaurants are still losing money, but we fought for it because it kept our people employed. And at the end of the day, while this is about the restaurant owners, I want to underscore it's really about the thousands of employees. In Anne Arundel County, we have 1,100 restaurants, which is tens of thousands of employees. And to the economist's earlier point, the auxiliary businesses that depend on us to be open, from the oysterman, the farmer, the linen guy, when you add those jobs in, you are talking about a massive unemployment event. And so at 25%, we're able to keep the doors open. We're able to employ about 30% of our staff, which is better than nothing. So, we'll keep fighting, but none of us are making money. And I think ultimately most restaurateurs have given up the idea of making money anytime soon. We just want to survive and get to the other side of this so we have a business for our people to come back to.
Absolutely.
And we want our elected officials to
happens.
work with us and understand that it's an extinction event.
I want to go back to Dr. Bailey very quickly. We're almost out of time. If people are eating out, what is the safest way for them to behave? Should they always put their mask up when the server comes to the table? Quickly.
So that's a great question, because I do think that when we see governments respond to numbers like this, we have to recognize that the responsibility rests on us. If we personally and collectively can drive the numbers down by our personal behavior, we can remove some of the driver for government responses like this. And so how we go to restaurants is a key part of that. And one of the things that I would emphasize, that really is underemphasized, is that when we go, we really should be going with our housemates. One of the things that would make a restaurant visit more dangerous rather than less dangerous is to go with folks who are not part of our household unit, to sit down with them. We're in close proximity, but we don't belong to the same house. And that instantly creates a conduit between our household and your household. And if that's not the only time we do that, if we're the kind of person that does that with other households, we create networks among these households. We have to be responsible about how we go to it. Your question specifically, should we take the mask down? No, you should have the mask on as much as you can have it on. It should be only off for the essentials, which is, of course, to eat. And it's back and forth, but it is something we can do. And we should be minimizing the amount of time we're out from under that mask.
Mr. Vignoraja, before we go, I want to ask, do you think restaurants will eventually defy the bans if they are not lifted soon?
No, I think they're going to honor what the rules are because they're rule followers. They take safety and hygiene very seriously. I think that's one of the things that's most frustrating for them. You can go play poker with strangers. You can be on a treadmill without your mask on at a gym, but you can't have dinner outdoors with your family at a place that is dedicated to the safety and hygiene of their clients and customers. I think that's been really hard for them. And it's not about the owners. It's often about the employees and all the families that they're supporting. And I think they're just looking for some science and data to guide the decisions instead of politics and theater.
Mr. Glassman, I'm going to give you the last word. Give us something positive to leave this conversation with about the future of restaurants in Maryland and our public safety and health.
Well, I think essentially we've got to continue the basics, and that's what we've really pushed here in Harford County to keep our businesses open, to have individual responsibility to wear your mask, wash your hands, do those things to mitigate the spread of COVID-19. And I think if we really bear down on that, and I agree with the other panelists, that we should be able to maintain our restaurants, our retail businesses, our small business at the levels prescribed by the state. And hopefully as the vaccine and the pandemic begins to fade here in the spring and summer, that we get them back open as soon as possible. And I would finally say that we do need more federal and state aid. If you're not going to open the businesses, you need to pass support to them. And in Harford County, we've done about $25 million to our restaurants in 2 separate grant phases. And to be honest with you, those grants are about $5,000 to $7,000 a piece and may only help them pay partial rent for a month.
Right,
so
it's not
there
enough.
has to be a lot more economic, right. It's got to be more if you're not going to open them up additionally.
All right, Mr. Glassman, thank you. We want to thank you and all of tonight's panelists for your time and your expertise. Clearly, this is a challenging, stressful, uncertain time, but hopefully we're turning a corner with the rollout of the vaccine and we can all get back to eating in restaurants all the time. Everyone, please stay safe and healthy. Thank you so much for joining us for this conversation. Have a good night.